I could have at least put some earrings on.
Hey, everybody. This is Cassidy, founder and creator of the Caregivers Hub, coming to you today. We are having our monthly Caregivers Hub Hangout, and I am super excited for this hangout because we have a phenomenal speaker here with us today, and we're going to cover a great topic that is much needed because in healthcare, whether you are a professional caregiver or you're a family caregiver, knowing what abuse and neglect is, how to be an advocate, and what your rights as a patient or a resident are is extremely important. So that's why I decided that we needed to cut on a live hangout and talk about these things, about how are we going to help you, Tiffany and I. That's our speaker today. How are we going to make sure that you have all of the resources that you need to be a good advocate for your loved one and for yourself as a patient or resident, and to navigate this healthcare system? So I'm super excited. As I said, I'm going to bring out our speaker, our social worker and patient advocate, Tiffany Matthews. So I'm going to have her introduce herself. I'm going to have her tell her story and how she became a social worker and why she became a social worker. So Tiffany, come on out. Introduce yourself.
Hi, I'm Tiffany Matthews. I've been a social worker pretty much on and off for about 20 years. And I've worked with all kinds of populations, children, recovering addicts. But my favorite population is, I don't want to say the elderly or seniors because my mom would take offense and she's 65. So, I'll say experienced adults or seasoned adults, my favorite population.
Me too.
Yes, the wisdom, the just everything about them just pulls me in. And, having, worked in a lot of different nonprofit agencies and aging agencies, I see the good and I see the bad. And I want to help with the bad. And I know that's why you're here. So I'm happy to be here. Thank you.
I'm so excited too. I mean, and you're so right. I think as, healthcare professionals, and, it's funny, I was thinking about this the other day, Tiffany, was, not until I got in hospice was it actually have, in 15 years as a CNA, is it the first time when I get to sit down with social workers and sit down with my nurses in an interdisciplinary platform, and we get to work together,
Right.
and get to learn what our roles are and how I think of you guys as like my biggest tool in my pocket. If I get stuck somewhere, and I'm in a situation that it's hard to handle, as outpatient hospice or home care in general, we're dealing with people's lives and we're dealing with their families and we're dealing with their environments. And sometimes those environments are safe and conducive and beautiful and everything goes smoothly. And sometimes it is a cluster.
Yes. Absolutely. You're absolutely right. And I think a lot of what healthcare doesn't understand right now as a whole is you have to treat the patient as a whole. You can't just treat symptoms or a disease and think, okay, we've done our part, great, and get on your way. Doesn't work that way. Doesn't work that way.
Well, and and it's because it's become lucrative to file people in, fix those things, then file them out. And
I know.
And it, and I often think about that, how are we going to impact the almighty dollar that has hold on this industry? And I think it's great. And my goal for, this entire thing and for the Caregivers Hub and for what I do here is to work with people, where we can come on a common ground and say, how can we fix this together instead of how can, I mean, because I thought about it the other day, I thought, boy, I could spend my whole life talking and not change a damn thing.
Right.
Yeah.
because healthcare delivery, and that's what I work on with people, it's a load of crap. It is. I'm not even gonna hold my
Don't
tongue here.
sugarcoat it.
It's
I'm
not a,
tired of
it's a,
sugarcoating it.
yeah, it's a load of crap. And what people don't understand is that they think that, as soon as they walk in to an appointment or a surgery or procedure, okay, all of their power goes out of the window because all they're there for is to feel better.
Right.
But in part of wanting to feel better is making sure that you have input, because patient input leads to better patient outcomes. And there's research on that all over the internet.
I mean, that's just, you would think it's common sense. I don't know how many times, I've showed up to a visit and maybe an aide has come out on the weekend, and I'm a case manager, so I'm not a float,
Right.
right? So I have set cases of people that I manage their care from an HHA standpoint.
Mm-hmm.
And they'll say, I didn't like this aide, and they didn't do this and they didn't do that, or and maybe sometimes it's usually it's usually hygiene related because that's
Mm-hmm.
what I'm doing. But I always tell my patients' families, you don't have to accept subpar care. You can
Oh,
speak up and say,
absolutely
I
not.
don't like the way, and because they almost feel bad for telling me, those things. And I always say, no, we as a hospice want to make sure that your loved one is cared for the way that you want them cared for and the way that they should be cared for. And if that's not happening, we need to know those things. And, so that's like my biggest thing. You guys don't have to accept subpar care.
No.
You can stand up for yourself, and don't
Right.
just let healthcare professionals, and I'm saying this as a healthcare professional, railroad you with their experience and their knowledge and their titles and their scopes of practice.
Right. Right. Or the white coats, or all the medical speak, or all that. Well, she has 3 contusions. It's a bruise, dude. Let's just talk. Okay, let's just talk. It's a bruise, dude.
Right.
I had to, I have 2 undergrad degrees and I
Mm-hmm.
have a master's degree. And I went to get a pain evaluation because I have chronic pain in my back and in my arms. And I said, well, what is this medication going to do? And there was a student doctor and then a doctor that was he was following, the student doctor was following rather. And the student went into, well, here's what happens. You know how your nerves go up and they go down and this and that. And, you take the pill and then it does something to your brain. And I'm like, stop. And then the older doctor who said, you know what? It blocks your pain receptors. Thank you. That's all I need. That's all I need.
I know.
I understand, dude, how you were trying to do all of that, but people don't get that. People don't understand that. If you start to tell me all that medical speak, I'm gonna zone out and I'm gonna think about what's for dinner, did I feed my cats, or whatever.
Right.
Do you know what I mean?
Absolutely.
And sadly, a lot of people deal with that when they don't have to. Part of advocating for themselves, you have to talk. My grandmother, God rest her, said, closed mouth don't get fed, baby. And it doesn't. You have to open your mouth so people know where you stand,
Right.
And a lot of patients just take what they're given, and it's so sad. It truly is. You're paying how many arms and legs in premiums, coinsurance, deductibles, copays, gas, time off work, whatever, to go and have a doctor talk down to you or
Mm-hmm.
tell you what he or she is not going to do? Oh, no, hun. This is what
Yeah.
you're going to do.
And what I'm seeing a lot, especially with home care agencies, and I'm not even going to sit here and say that every home care, agency is the same. Some of you are fantastic and you do what is right and you have good caregivers and you're great. And some of
Absolutely.
you are horrible. And
Absolutely.
I think it's incomprehensible that we allow people to pay upwards to $300 a day for 24-hour care with people who aren't educated or experienced to provide it because they don't have a license to provide medical care.
Oh,
you know what I'm saying?
We need either a 10-part series, or we need to go on past what is it, 9 o'clock here? You're bringing me so many different places, because I can talk about this. People, I don't care what the situation is, whether it's end of life, whether it's discharge planning, whether it's nursing facilities, short-term or long-term, hospitals, clinics, doctors. You are the expert on you, your situation, your body, what affects this or that. For example, my daughter, she's lactose intolerant. Hates it, but she is. But she's the one that can speak up about how that affects her. A doctor can guess, but I know for a fact that, two people with the same disease can be affected in 2 different ways.
Right.
So you have to speak up. You have to talk about your unique situation, because, I have a chronic disease. I have diabetes, and what affects me in one way can affect a friend of mine in another. And we could be on the same meds, go to the same doctor at the same hospital. Doesn't matter. That's why people have to talk about their unique experience, and they can't be afraid.
Right.
There's no such thing as being afraid when you're paying $500 a month for a premium.
Exactly. And I think that leads us into what an advocate is and being an advocate. So can we go over what the definition of an advocate is, and what your role as a professional or a family caregiver is as an advocate for anybody you're caring for?
Sure. Being an advocate basically is speaking up for or championing the cause of yourself or someone else. Caregivers, of course, for the people they care for, or, patients for themselves. And what happens is, being an advocate, you have to be able to know what you're speaking of. Therefore, you have to educate yourself on what's happening. Educate yourself on the facilities in your area. Know what they take care of and what they don't. Know about your conditions. And I don't mean be able to write a doctoral thesis about it. I mean, know what's happening. What is the latest research? What are the medications and the treatments for your conditions?
Right.
Does your local clinic or urgent care deal with these kinds of things, or don't they? Because if you go, it's a total waste of time, So you have to know about that. You have to know about your providers. I had a doctor on health grades. He had 4 stars, or however they run it. And I went to him, and he was my doctor for a little bit. And he told me, well, take this medicine because that's what's going on with you. You've got a bladder infection. That's why your stomach hurts. I said, no, I've had a bladder infection before. I know how that feels. This is not it. No, just trust me. Obviously, he wanted to rush me out of there. Okay. Took the medicine. I decided to go to another doctor because I'm not going to alter my body by one thing that you say and you think. It would be different if I believed it and the symptoms fit, but it didn't.
Right. So I guess that's a really good thing to highlight there, is that, when things like that happen, that you don't just take one person's, if it doesn't feel right to you, if you're not being listened to, and I think that when you sit down with a doctor, you can say those things. You know what? This is what I expect from my care. And is this aligned with your philosophy? And how are we going to work together for my care?
Right.
It's okay
Right.
to say those things. It's
It
okay to
absolutely is.
ask for those things. And we should be doing that.
Absolutely. This is what I mean by advocating for yourself. You have to be able to have a firm understanding of what's going on
Right.
when you leave the appointment. Never, ever, ever leave your appointment saying, now what happened?
Right.
What did she say? Don't do that. You're
I
playing
know.
with your health. A lot of people think we use these cliches when we say playing with your health you are. You are. That's
Yeah.
it. That's all. And my thought, with all of that kind of stuff and being an advocate is you have to educate yourself. You have to be able to have the confidence to stand up. And confidence comes from just taking that first step. Look, doc, I'm not happy with this treatment plan. Can we
Right.
talk about another one? And once that happens, your confidence builds and
Right.
you'll keep doing it, you know?
Yeah. And absolutely I agree 100%. Knowing, I mean, we get that a lot with Alzheimer's and dementia, right?
Oh,
It's exploding. And we have
yeah.
so many families and medical professionals who are uneducated about what's happening, about the
Oh,
process, about the disease process. And so there's a lot of, which is like, these are like almost my critical people. You know what I'm saying? These are the people who really
absolutely.
need the advocacy. They need you to be an advocate because they can't speak for themselves. They don't know
Right.
how to speak for themselves. And so by you educating yourself about a disease process that your care recipient or your loved one you're caring for has is imperative. When in
Absolutely.
doubt, Google it out. Google is your friend. You can ask
Hmm.
Google anything. By all means, buy an Alexa and ask her a question.
Right.
Like, I mean,
It's true. It's
yeah,
true. You have to know what you're up against. That's the art of war. You have to know what your enemy has basically ready for you. And if it's something that I could ever do, I would get rid of all kinds of dementia. I have seen the devastation, that and
hmm
cancer.
hmm
I would get rid of both of those. But yes,
yeah,
you have to be educated because there's many different kinds of cancer and there's many different kinds of dementia.
yeah.
There's vascular, it's more organic, and then
There are
Alzheimer's.
98 different diseases under the dementia umbrella.
Oh, and
Right?
all of them are devastating. All of them,
Absolutely.
you
So I
know?
want to talk about so we've defined what an advocate means, and I want to talk
Mhm.
about abuse and neglect. And I actually I looked up the different forms of abuse and neglect, but I would love to go over that. But I think we have some great questions from Hubbers, by the way, for
Okay.
you. I know I'm super excited because they're pertinent. The Caregivers Hub is a support group of 4,700 members all over the world now that are medical professionals, family caregivers, cancer,
Mhm.
Alzheimer's. We have people like Tiffany, social workers. We have doctors. We have ARNPs. We have, so many people in the hub. And that's why it's an incredible resource for you to be an advocate because we are going to put all this information in our files as well. So, um,
Absolutely. And
so I
ask me back anytime. I'm loving this.
absolutely. I know we could go over so many things, but I want to talk about what defines as abuse and neglect.
Right. Abuse and neglect, which, God, is rampant,
Right.
rampant in hospitals, nursing facilities. It's mainly, it could be physical, it could be emotional, it could be financial. It could happen in your home, a hospital, a nursing facility, all those different kinds of things. It's basically, to me, improper treatment in every way.
Right.
Something that demeans you, something that's disrespectful, something that doesn't go with your treatment plan. If I'm forcing someone who's bedbound to try and walk 150 feet, that's abusive. That
Right.
is abusive. You know, and in the healthcare system, there are a lot of things that people can and should look for.
Right.
For example, when my grandmother was on her deathbed, she started developing bed sores that she never had before. So, of course, me, loudmouth, whatever, and that's my Gram. She's like my second mom, so you're gonna hear from me, you
Right.
know. Uh, why are you not turning her every 2 hours? See, I had to approach it that way as opposed to, why are her bed sores developing? Why is
Right.
she getting these? Oh, from lying in bed. You know, in healthcare, I'm sorry to say it, but you will get to have you go away ASAP. Seriously.
Oh yeah.
Um, but I said, why are you not turning her every 2 hours? Oh, we are turning her every 2 hours.
Right.
Clearly, you're not if her skin's breaking down or she's lying in her own urine. You know
And
what I
so,
mean?
you know what, family caregivers, you know how you're going to avoid that? Just like what Tiffany said, what you're going to do is you're going to get a big clock and you're going to print it out and you're going to print a sheet and you're going to tack it on that wall and you're going to hold those caregivers accountable for when
That's
they
right.
turned them, and then they're going to initial it. And
Exactly. Perfect.
if your adult family home or your nurse manager or all of those other people do not want to do that, there's your red flag. Why?
Exactly.
Why do you not want to do that? Why do you not want to hold your caregivers accountable? This is the number one thing I go in every day in outpatient hospice, in skilled nursing facilities, assisted livings, adult family homes, with
Right.
people who are bedbound. And sometimes, I've seen it, no matter how much you turn somebody, they could be on pillows. Their skin integrity sometimes just fails. It's the nature of their body. People with diabetes, even worse, right? It's once that ball gets rolling, it's extremely difficult. But when I get upset is when I am being met with that attitude in how I don't know how many times I have to say, okay, position them this way. Don't put 3 layers of pads under this person. I understand it's easier for you, right? But it's not helping the skin on this patient. We're going to
Isn't
mix
it
these
about
two.
the patient? Isn't it
Absolutely.
about the patient? Isn't it supposed to be?
It's
But
supposed
there's
to be.
so many, there's so many places. The entire system of healthcare is so broken because it's
Absolutely,
fee for
100%.
service. It's fee for service versus patient-centered care. If
Exactly.
you can see, if a
Exactly.
doctor can see 60 patients in one day just to make sure his kid's tuition is paid for, his portion, his mortgage are paid for, you're damn right that's what he's going to do.
Right.
You know?
So
It's
that's
not about patients. So patients have to take their power and make it about you. This is
exactly.
what I scream, yell, and just every day. You have to
Me
make
too.
it about you.
And that's what I'm
Make
saying is, like, after 15 years in this industry, it's so
Mhm.
hard for me sometimes not to be jaded and not
Oh,
just
I
want to walk
know.
out and go work at the garden center and Lowe's instead of dealing with this
Right.
shit every flippin' day.
Yes.
And then and so professional caregivers, especially for those of you like myself who care infinitely about what you do and spend
Right.
everything you have giving to other people, you have to protect yourself as a professional caregiver. You have to
Absolutely.
document, 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 document. It
Right.
doesn't matter if you think it's insignificant, right?
Hmm.
You got to document it because that covers your butt.
Right.
And so if somebody asks you to write when you change them or how you change them or how often you change them, and you say this is when you do it and you initial it when you do it, they're going to hold you liable for that.
Absolutely. And that's your career and possibly your freedom. And I
Exactly.
encourage patients and, patients and caregivers too. When you see a doctor, first of all, everyone should have a complete medical history.
Mm-hmm.
And within that, you can have a record of when you've seen doctors, what tests were done. I don't care if you use one of those little tiny flip notebooks. Use something. Say when something was done. List who you were talking to, document what they said, when, how, and whatever's happening, because I promise you, they won't remember. but you have to. Healthcare is the responsibility of the patient. No
Right.
one cares anymore.
It's
It's
true.
up to the
And
patient.
so actually, I want to talk about, we're gonna go over patient bill of rights and resident bill of rights. If you don't know what those are, don't worry, because this all may go in one ear and out the other. But in the hub, I'm gonna create a file. We have an entire list for every 50 states. We have every state ombudsman number in every
Great.
state for you to call. Okay, we're going to go over what an ombudsman is in just a second. But I want to talk about patients' Bill of Rights. I'm going to read it to you. And I guess this kind of, as I'm seeing it, adopted in 1995.
Isn't that sad?
1995.
Isn't that
So,
sad?
absolutely. All patients as of 1995, today is 2018, should be guaranteed the following freedoms: to seek consultation with the physician of their choice, to contract with their physicians on mutually agreeable terms, to be treated confidentially with access to their records limited to those involved in their care or designated by the patient, to use their own resources to purchase the care of their choice, to refuse medical treatment if it's recommended, to be informed about their medical condition, the risks and benefits of treatment, and appropriate alternatives, to refuse third-party interference in their medical care, to receive full disclosure of their insurance plan and in plain language, it says, which includes contracts, incentives, costs, coverage, qualifications, approval procedures, referrals, appeals, and a gag rule, which means whether physicians are subject to a gag rule preventing criticism of the plan.
What a novel idea.
Right? I'm like, okay, really? So you can't.
What a novel idea. Privacy? Wow.
I know. And so
I'm honored.
I know. And so that means, so you as a patient being provided care to in a hospital, these are or even just a provider, your doctor's office, whatever, these are your Bill of Rights. But there's a different Bill of Rights for residents, okay? These are residents of adult family homes, skilled nursing facilities, assisted livings. So the Resident Bill of Rights, the Nursing Home Reform Act established the following rights for nursing home residents: the right to live in a caring environment free from abuse, mistreatment, and neglect; the right to live without the fear of enduring physical restraint; the right to privacy; the right to receive personal care that accommodates physical, medical, emotional, and social needs; the right to social contact, interaction with fellow residents and family members; the right to be treated with dignity; the right to exercise self-determination; the right to exercise freedom of speech and communicate freely; the right to participate in the creation and review of one's individual care plan; the right to be fully informed in advance of any changes to that care plan or status of the nursing home. That's a huge one. The right to voice grievances without discrimination. I say the right to be fully informed in advance of any changes to a care plan or status of the nursing home is huge, because I see all of the time POAs coming into the hub saying that medication changes or room changes or all sorts of things have been done without their knowledge, which, as you can see, is not legal for them to do that.
Absolutely. Absolutely.
So,
absolutely. And I've worked in multiple nursing facilities, and
yeah, I know. I know. Take a deep breath.
Stuff that they get away with.
I know. I mean, and listen, you know, it's crazy. I know.
Anyone out there who thinks that their caregiver duties are finished once your loved one is placed, whether it's in an assisted living, a boarding home, a nursing facility, you're wrong. If anything, you'd have to put more energy into keeping them in line. Right. Because again, they're giving a blanket solution to unique people by basically warehousing them. And right. I'm going to say it that way.
It's true.
It is true. And, you know, as far as social interaction, I've seen residents stay in their room all day in their own excrement, ringing bells. I've seen bells ring for 20, 30, 40 minutes. I've seen people say, oh, he just wants this or that. He can wait. I've seen it
Right.
all. It's the truth. You have to have a way, establish a pattern or a presentation, so to speak, to staff and say, hey, look, I'm a part of this game. I'm here and I'm going to be here regularly. And if I'm not here, I'm going to call. You
Right.
know, something that gives them the notion, okay, this family's involved.
Right.
And I'll tell you, with the different nursing facilities I've worked in, it makes a difference. I promise you.
And
I guarantee you it makes a difference.
I mean, I cut my teeth on nursing homes. I doing this for 15 years. I've only been in outpatient hospice for 2 years come this June. But I've worked for home care agencies. I've worked in skilled nursing facilities. I've done private care. And my philosophy of care and my quality of care and the standard of care with which I hold myself accountable to is usually higher than most. I don't want to say this and be an asshole. But you know what I'm saying? Like, you have to hold yourself accountable to the care that you provide. It doesn't matter where I work, in what setting I work. Right. I take physical, mental, emotional, and spiritual care of every single person that I come in contact with. And Absolutely. I do that with compassion and respect and dignity because that's the type of human being that I am. And, on the other hand, I'm going to slightly stand up for the certified nurse's aide. We are just as abused sometimes.
Oh, know.
As our patients, right? We show up low staffed. I showed up one day to 30 people on the back wall. I was only one of 2 people in the entire facility.
I believe it.
And I cried for 8 hours. I had I could literally only change feet in bed for 30 people in an 8-hour period.
I believe it. I know.
All the way around. So when we say healthcare is broken, it's broken because we are being charged an incredible amount to put people in these facilities, right? And then we have so many different determining factors. I have seen beautifully run facilities change hands in management and be run to the ground.
Right.
And your leadership is everything. You guys who are in leadership positions in healthcare, take care of the people who are taking care of the people you are dedicated to serving, who you're paid to serve.
Right. And it's the administrator that gets the most money, the best parking spot, and doesn't have to go onto the floors because they are in their little comfy, cozy office and they only deal with the face of the facility. That's it. It's the people that are on the front lines that are really, really doing the hard work. The CNAs, the nurses, I give you guys all the credit because I'm telling you now, the whole healthcare system, I don't care what kind of facility, would not run at all without nurses, medical assistants, CNAs, and, of course we need doctors. Let's give them their due. But you all are the lifeblood of that system, honest to God.
Absolutely.
And it can't run without patients and caregivers. They're not getting their due in this system. And, in nursing facilities, I've seen, oh God, if you want a couple of stories, I can give them to you.
Absolutely.
No, I mean it. I'm so serious. I worked in one facility where a lot of the hygiene was poor on a lot of the residents. It was social workers like me who had to make sure men had haircuts and everybody got their toenails and fingernails, they're on schedule. I had a whole tickler system.
Good for you.
In my office. Okay, it's 30 days. He needs a haircut. She needs her nails done. All of that kind of stuff. Poor hygiene is abusive. If you're not letting me feel clean and good about myself and well presented, that is abusive.
Right.
You know,
Absolutely.
to me, especially if you're paying,
Absolutely. I've the same. I've, you know, like, I mean, hospice is on top of care, not in lieu of care. And so a lot of people assume that once people come on hospice that they don't have to continue to provide them the level of care. And it doesn't matter if they're in ALF, a SNF, you know, or an adult family home. I had toenails this long on a man one day when I showed up. And I thought, what the fuck? What the fuck?
And let me guess. Under his nails were feces.
Oh, it was his toenails, yo. It was his toenails, yo. And so what did I do? I got a big clippers and I just chipped away at those nails until they were done. And it's these little things, you guys, professional caregivers. I know you're tired. I know you're not paid well. I know you're short-staffed. But for the love of Pete, take a flippin' pair of clippers and clip those patients' nails. If they're diabetic, don't play the diabetic card, because you can take a nail file to those nails. Or you can actually go to your nurse and ask her to trim those nails so you can file them.
Well, you know what? Then there comes accountability if something goes wrong.
Right.
So it's a catch-22. If I take it upon myself to do it and I just happen to nick a hangnail or something, and you know,
right. But that's what I'm saying. It is a fine line.
You know, everybody has to play their role, and I'm all for the extra mile.
Right.
But I've also been hung myself on going that extra mile.
I get you.
And in nursing facilities, you know, certain states have laws where there only needs to be 4 people for CNAs for 60 people. The laws need to be changed.
Absolutely.
And they're only paid $9 an hour. I can give a damn about what's going on if I'm being paid $9 an hour.
Exactly. Well, and you know, here we had a law passed in Washington State, in Seattle, downtown Seattle, food workers, they want to be paid $15 to $16 an hour.
I saw that.
And it passed. And they do.
And it needed to.
Yet, okay, perfect. However, I have a state license. I'm educated.
Right.
And in any facility with low experience, am going to make $10 to $12 an hour.
To have to go in, 2 people have called out, you and someone else and maybe a third person have to deal with however many people. Now let's talk about what these people need. Wound care. They need turning, bariatric care. Okay? They need to be fed. They need to be washed. How many showers? And you have to stand there and do it all day because the law allows this. Or nursing facilities try to get away with less than the ratio needed. So
professional caregivers, don't be afraid to call the state on your facility.
You're paying $6,000, $8,000, $10,000 a month for that care. People have had to spend their life savings to be able to qualify for that care. You tell me if something's wrong with that or not.
I agree with you 100%.
Let me tell you something. The only person I would put in a nursing home, if I had any say over it, is my ex-husband. That's it.
I get you.
That's all. My ex-husband, and he deserves it. I wouldn't put a dog in one of those places.
But yeah, I know.
Sometimes that's the only choice you've got.
Right. But that's when it becomes important that you still maintain your advocacy and still maintain a quality of care, even if that's your only option. I mean, I get it. You know, I work full time. If my dad right now went and had any issues, he would have to. I'm not in a position to quit my job at 33 to care for my dad. But at the same time, I'll be damned if I'm going to put him in a nursing home and I'm just going to leave him there and assume that those medical professionals, albeit they're medical professionals, are doing everything that they can to provide him the best care, because I work in this industry. I see it. I know. He was in the hospital for 7 fucking days. Nobody even offered him a flipping bed bath until I came in there and and said, I need this, this, and this, and this. If you're not going to do this, I'm going to do this. And I made him do it. I'm like, the man has COPD and emphysema. If he's here because he couldn't walk 25 feet to the bathroom. What makes you think if you bring him the stuff, he's going to do it himself?
He's not.
What?
He can barely catch a breath.
That's what I'm saying.
If you will allow me, can I tell you how I got into business?
Absolutely.
I got into social work because I wanted to help the world. I like to think I've always had that helping personality. And you certainly don't go into social work to get rich. At all. But,
same here.
Exactly. But, and a lot of the reason why I started my business is because of my grandma. Now, with her, me and my mom and my father lived downstairs and my grandmother lived upstairs. All my formative years. And, it was chaotic in my mom and, with my mother and father. They were young and they had a kid and, but my grandma, she already raised her kids. So, if it was like chaotic downstairs, I'll go upstairs. Or if I got in trouble, I'm going upstairs. And my grandmother would be like, now, don't beat that baby. Don't do anything to her. She don't know no better, honey. Now, don't do that. And then my mom was trapped. I was like, yes. So, my grandma was a savior for me in a way. And, when she became ill, I had moved away. And, I was 300 miles away and I couldn't do anything for her. And at the time I was a discharge planner in a hospital. So, I cozied up to a lot of doctors. What can I do? How can I help her? What can we ask? What can I say? Because it's different when you're a social worker and you're helping other people. And by God, you can only do it to a limit in a hospital. Okay. If you're wondering out there who people that work with you are loyal to, check out where their paycheck comes from. Okay. That's who they're loyal to. I've heard of all these hospital navigators and these patient advocates and nurse navigators and yada, yada, yada. Great. Any advocate, I'm rooting for you. But you better believe that their loyalty is to whatever facility they work for. I am a private and independent advocate, so my loyalty is to who is paying me. Patients, caregivers, families. And I'm a pit bull. I'll go to the mat for them. I will. I do not like injustice. So with my mom calls me one day and she says, you know what? I'm going to jump out of the first window I see. I said, oh my God, why? She said, this hospital, they're trying to send home your grandma. She's got a trach. No one's teaching us. No nursing facility is coming out to see her. We don't have tests. We don't have a diagnosis. All of this stuff. I said, Mom, I want you to go and get a cup of coffee and let the social worker talk to me. She said, okay. So they wanted to discharge her that day naturally. And discharge usually means, from any facility, you're not making us enough money to stay here anymore. So it's time for you to go so someone else can replace you.
Right.
Bottom line.
So they can.
And I'm being as honest as possible. So I spoke with the social worker. I said, look, sweetheart. I said, I play the same game as you every day. Well, by then I had became a hospital exec in communications. But I said, I've played this game in and out. She's like, well, your grandmother's insurances aren't going to be paying anymore. I said, oh, really? Which one of the three is not paying?
Right.
Usually most people have one. She had a primary, a secondary, and a tertiary.
Oh, my gosh. Okay. Yeah. So that should have been covered all the way.
Okay. She had Medicare. She had AARP as a supplement, and she worked for the state of New York. So they were giving her an insurance. I said, so which one of them are you talking about? No answer. I said, look, sweetheart, what you're doing is an unsafe discharge, and I know it. You may be able to get over on my family, but you're not getting over on me. Okay? So you go ahead and you try to discharge her the way that you're trying to. And I'll have the Department of Health, the Joint Commission, and the Center for Medicare Review in there so quick, all over your files, honey. You won't even know which way to turn. Okay? I said, you try me. Now you have a wonderful day. So my mom calls back like an hour later. She's like, what did you say to her? Did you threaten her? I was like, Mom, I know sometimes I have an anger problem, but no, I didn't threaten her. I threatened her professionally.
Right.
She said, well, I don't know what you said, but the doctor's on the way down, the nursing facility's on the way out, and da-da-da-da-da. And she said, they're moving now, honey.
And that's what I'm saying. But why do we have to get to that fucking point?
Exactly.
Why do we have to get angry? And then, and then there's that gap between medical professionals and family caregivers. That's that hostility that comes with it, because we aren't. I don't even know how the hell we're going to fix it.
And even when you do know what you're talking about in a facility and you demand the right care, you're labeled a troublemaker.
Right. And they will.
And
they will
part of that machine who did it. So I know I was part of that machine. I did it. But I'm like, wait a minute. Why are they being labeled troublemakers for knowing what they're talking about?
Right. Well, I mean, what's wrong with demanding? I mean, I don't know how many times, and I get this sometimes too. Like if a family caregiver says to me, like they have a certain way that they have been caring for their loved one all the time, right? For years. And here I come in with my 15 years of experience. It's not my job to show her or tell them how, because I'm a CNA and I'm experienced, if they say, I would like you to do it this way. Yes, ma'am. Absolutely.
You have to meet them where they are.
Exactly. I often tell people, like, you know what, especially if it's the first time, even if it's just a paid caregiver, you show me your routine and then we'll do some tweaks. And, if it's not safe and I see you transferring somebody and we could do it better together, we're going to work on that. Right. But if you have a certain way that has been working with this patient because you know this patient and you know how they move and you know how they act, then I want to know that so we can, so I can tweak what I do to care for them. And that's the problem. We can't just walk in and downplay and discredit family caregivers, because we need to remember that by the time that they reach us, they're tired, they're broken. They are absolutely strapped. And then on top of everything they've already been through, now they have to deal with us. And
that's horrible. My mom was the caregiver for my grandmother.
Right.
That's why she said, I'm about to jump out of the first window I see. Right. And I felt bad for being away from that situation and not being able to help. But when I finally spoke to that social worker, I felt like I did something in my grandmother's name.
Right.
I felt like I helped out. And it made me think, how many other people out there are being treated like this?
All over the
place.
That's
why I started working this way. And I started my company because I said, I don't want another family to go through what my family did. We were trying to mourn our matriarch.
Right.
We didn't want to deal with the business of healthcare or pressured decisions. Well, you're going to put her on hospice or not? You're going to take her off life support or not? I mean, literally, I sat there a whole day because my boss was gracious enough to let me go from a brand new job and see my grandma. And I sat there and I watched how many times those doctors came in. Okay, did you decide? What are you going to do? High pressure decisions, high pressure kind of sales pitches even. I don't want anyone else to deal with that.
Because it's like a never ending wheel. They want to file you in. We had a nurse in Oregon maybe 2 or 3 years ago. she was noticing that these patients were being discharged before they were actually should have been discharged.
Oh,
and
man.
so she reported it, and then the hospital fired her.
Of course they did.
So she said, absolutely not. She took them to court. She won $2 million and they were fined. Crazy, right? And that's what I'm saying, is that as medical professionals, we are so, and the laws and the policies and procedures, I know they're there to protect us. Absolutely 100%.
Right.
But they are outdated. They are black and white, and we fall in the gray. We fall in the gray because we're human beings. And we are so afraid that we're going to lose our jobs and our licenses and our livelihoods that we don't speak up for ourselves and what's right and what's wrong.
So you stay a part of the machine. Don't get me wrong. I was a social worker. I had a child to feed. I had a home to take care of. I had to do what I had to do. But I would tell families, I would say, listen to me. I'm going to give you this tip, but if you ever say I said it, I will deny it. And I would give them what I could beyond what the hospital or nursing facility would let me.
Exactly.
And that, unfortunately, has become how it is. And I couldn't stand that anymore. I couldn't. Well, so that's why I started my own thing, so I could do it the way I wanted.
And I want to hear about that. Tell me what you did, and tell me about your company.
Well, my company is called Live Better Boomer Healthcare Advocacy. And I dedicated it to my gram and learning from her situation. And I said, I want to help people in situations of, healthcare crises, end of life situations, and being anywhere along the spectrum of your healthcare journey, whether it's appointments or how to deal with a doctor, or if it's something, okay, let's get our planning taken care of, advanced directives, making the most of, estate planning and those type of things. And I've kind of wrangled it all that information for patients and caregivers. I wrangled it into 20 modules.
Awesome.
And I have what our signature offering is at LBB is called the Powerful Patient Partner Program. And it's going to teach you how to communicate with doctors, how to avoid medical errors, managing your meds, managing surgeries, appointments, hospital stays, how to talk, how to build your confidence, how to, what questions to ask exactly, at an appointment, for a surgery, for a procedure, all these different kinds of things I've got.
Awesome.
And you can, learn them, and you have access to them 24 hours a day. Now, I'm still building the program, so I'm doing the final touches to it. But I want people to come to my website, look at it, find out what you can learn. Believe me, I am on your side. I'm not supported by any, corporations like other patient advocacy groups are.
Right.
And still supported by big pharma. Or like other advocacy groups are. I'm telling you the real, I'm telling you the truth as I've seen it, as I've worked it, as I'm a patient myself with a chronic illness.
Right.
So I use what I know.
Awesome.
And I'm like, I'll ask questions. So, go to my website, look it up.
Shoot me the link to your website, and we will put that in this file as well, because I want to make sure that you hubbers, any caregiver, professional or non-professional, come to the hub. If you're in the hub and you're not looking in the files, what are you doing?
I mean,
what are you doing?
What are you doing?
The files are huge.
To help you. We are out here to help patients.
Absolutely.
But you have to want the help. You have to want to put the effort in.
It's true. I mean, a lot of it. I mean, I have, we had End of Life Washington come and talk to, our Death with Dignity. So we have advanced directives. We have all of the resources, POAs and all that, powers of attorney, all that stuff via End of Life Washington. I mean, they have Alzheimer's advanced directives, I mean, this stuff is available to you in the files of the Caregivers Hub support group.
It is. Do not sacrifice your power, because
Right.
the power is in the hands of the patient. That's the only way that healthcare is going to get any better. If patients and caregivers stand up in high numbers. That's why I
Right.
called my company Live Better Boomer, because these boomers are coming in and they already have that revolutionary spirit. You know, the feminist movement, the Vietnam movement, the civil rights movement.
Mm-hmm.
You guys already have that spirit. So use it with your healthcare. Adopt the attitude that, wait a minute, I'm going to ask the question and then question the answer.
Yeah, I like that. That's
And I
great.
smell a collaboration between me and you. I
You
can
never
smell it all the way
know.
in Philadelphia where I am. Okay?
Absolutely. I love it. Absolutely. And so on that note, I want to get into some of them that were, and this is a good one. This was from Marsha Burr, who is, I love it. Marsha calls herself a care thriver, not a care survivor. She provided care to her wife who had Alzheimer's until her passing. She's she is a former X-ray tech, so she's been in the healthcare industry. But Marsha says often caregivers are accused of abuse and neglect when their loved ones begin falling. What are some good suggestions to help keep both the loved one and the caregiver safe? How can the caregiver avoid any legal hassles that might arise from such accusations?
As far as I know, for one, I teach a track on fall prevention.
Okay.
And, you know, there are, again, education comes into it, because there are a lot of diseases that, or conditions that will cause you to fall.
Right.
You know, it could be eyesight. It could be nutrition. It could be weakness from, I'm sweating because I'm so like ready for you guys and passionate about this. Forgive me with my oily look. But you know, caregivers are considered, you know, first in abuse. You know what I mean? And if this person has anemia or some sort of easy bruising kind of condition, that could come from weakness or a fall, or, you know, hitting your arm on something. All people see is the bruises. They don't ask enough questions. So caregivers have to be able to volunteer that information and have it as a part of their complete medical history. Hey, she's got, you know, a lack of whatever vitamin that causes bruises. So look into that first. Make sure you have a complete medical history.
Right. And another thing on that one too, I want to say is, again, family caregivers, professional caregivers, get yourself a notepad. And, you know, the main thing that I've found, and this is purely speaking off of my own experiences with, you know, watching state come in and do investigations or whatever, they want to know what the problem is. They want to know what you're doing about it and how you're going to fix it. Right. And they want documentation about all of that. Absolutely. And half the time, if you say, hey, look, you know, here's a scenario, and you have a written log of every single time, you know, something has happened like that, you know, mom had a fall this day and this was why. Right? And then how are you going to fix it? Okay, is it because maybe the bed needs to be moved against the wall where they're always getting out on the other side of the bed? Do we need a body pillow to position under the sheet to make sure they're not rolling out of bed? Do you need a fall mat?
Right.
You know, do we need to get Medicare to pay for that? You know? Right. And all of these things come into play when people are looking in investigations about what's going on.
Absolutely.
If you have that documentation.
Because abuse is more than just bruises. You know what I mean? Like, for example, when my daughter was younger, and even now, she is a professional fall down artist. Okay. She has an injury. I'm telling you, it's almost every week sometimes. And, you know, I thought to myself when she was younger, oh my God, if I bring her to the hospital, they're going to think I'm beating her or doing something. But you know what? Abuse is more uh, lifestyle-ish versus bruises and injuries here and there.
Mm-hmm.
It's a physical thing. It's an environmental thing. It's a hygiene thing. You know, I mean, if this woman is taking care of her wife, and say there was poor hygiene and lack of food, or physical issues, and lack of nutrition, lack of care, then yeah, okay, I'd be more likely to start wanting to investigate more.
Right.
But if this woman is well taken care of and she just has some bruises from falls and from her conditions, leave them alone.
Right.
Leave them alone.
I think that, and I mean, you're in this industry, you've worked in these healthcare.
Oh, yeah.
It's like, I think that, and same for me too. I think we've always been weary about these things. You know what I'm saying?
Right.
Because where is the line? And you're right. I mean, if someone just falls and hits their head, okay. But,
I'm not abusing my daughter, and she has a medical history.
Right. So I
can blow your mind.
To answer Marsha's question, document. Mm-hmm. Document what happened, document why it happened, and document what you're doing about it.
And make sure all medical professionals involved are aware and on the same page, which comes from that documentation. Care coordination is critical in a situation like that. When you document what's going on, you make sure all the cardiologists, the neurologist, all of them are on the same page, and that it came from you.
Right.
And document what you told them.
Absolutely. Okay, the other one, which we kind of already answered, from Doris Bush Whipple. I keep hearing about the elderly being mistreated in rehab. Should my elderly parents refuse the rehab recommended by the doctor after being in the hospital? I
don't say refuse their care, because there are a lot of nursing facilities out there that do excellent work. Physical therapy, occupational therapy, speech therapy, after a stroke or after a surgery. They really can provide the care that is needed to get mom or dad or your loved one back home.
Right.
But we're still telling you that you need to be a presence there so that they get the treatment that they deserve and that they're paying for. Okay? Right. Do you really have to be a presence? Make sure that you go or that you call. You make sure they have hygiene.
Right. And that means being your advocate. We talked about advocacy. This is the answer to that question. Don't refuse it, but be an advocate for them.
Right. Stand up. Make sure you know what that Bill of Rights is, and that you're holding your provider, nurse, CNA, doctor, anyone, holding it to them. Most people do not know this. Many people don't know, but when you go into a resident's room, you have to knock and announce yourself. That is their home.
Right.
I'm not going to have somebody walking in my home like that. That is their home. That is a level of respect, and you should demand it.
Right.
And if you're not getting the correct care, know where to go to handle that. Your ombudsman, an attorney. I have seen people die in nursing facilities because of poor care, poor treatment, anger, frustration by staff. You have to be a presence regularly and continue documenting who you spoke to, what you spoke about, the date, the time, everything. Be an advocate.
Right. And she's right. Your ombudsman. Absolutely. We're going to get into ombudsman after this. Andrea Jensmore. I would like for neglect and the patient's right of refusal to be discussed. There are many times where a person refuses a shower to bathe and the family is upset that it's not done. They feel it's neglect. In reality, there's only so much that staff can do, which is right to a certain degree. But I'm kind of the philosophy, we can't allow people to refuse care to the point of neglect. We can't do that. Okay. If it, maybe we need to talk about pre-medication. Are they in pain? Do you know the signs of nonverbal signs of pain for people with Alzheimer's and dementia? Do you need to reapproach? I mean, I have one little man, he would not get into the shower whatsoever, but he sure as shit would sit on the toilet and let me give him a sponge bath. But yet every time I walked in, he's refused. Well, and how do we work together to change that?
You got Cassidy. You got me so passionate here. I'm telling you, I'm just sweating. This is what I live and breathe and eat. And in situations like that, again, you have to go meet people where they are. If he's letting you give him a sponge bath, so be it. He's clean.
Exactly.
But what a lot of families have to understand is if this person is of sound mind, or if this person has a real behavioral issue, then there needs to be some more discussion in those regular quarterly family meetings that you're supposed to be having about what to do and how to handle it. Now, I totally understand, sometimes trying to get my daughter in the shower is I have to say it 20 times, I really do.
Yeah.
But if she refused it, okay, what's going on here?
Right. Why?
There's something happening, whether it's cognitively, physically, emotionally, whatever.
Right.
Even though I encourage people to be advocates and I don't always have the best things to say about healthcare and the healthcare system or providers, I encourage partnership. Mm-hmm. It has to be done by both parties. Both parties' expertise is needed in order to have treatment plans, care plans, whatever kind of plan of care.
Right. Oh yeah, absolutely. And I mean, I provide, and I'm not even tooting my own horn. It's because it's the truth. I provide incredible care, but there are times, even with everything that I do, I still get beat up, you guys. I still get beat up, but at the same time, they can beat me up all they want. But at the end of the day, is her bum clean? And from here to her feet, are they clean?
That's right.
Yes.
That's right.
And I have the scars to prove it.
That is right, honey. I'm telling you now, and even social workers, they get beat up too. Well, why wasn't this done? I wasn't there. I was home for the weekend.
Right.
So I mean, it's a lot. And, with abuse, you have to look for things that are out of the ordinary. Are bed sores there? Are they not eating? Is it documented that they're not eating? Is there a reason why? Has the nutritionist come in to find out?
Right.
They're dehydrated. They're not drinking. Okay. Has there been a plan by nurses or the facility to deal with that? If not, has the family been notified?
Right.
You need to be notified of falls, of dehydration, malnutrition, or you have to report
changes.
Right. Yeah. And you have to report unsanitary conditions, environmental conditions. Say, look, this blood that happened with my grandmother in the hospital. Her blood was on the floor for days.
Oh no.
And
absolutely.
This is where she's dying, for God's sake.
I know.
Blood, it's disgusting. You have to be able to stand up for that and know that you don't have to deal with that.
Right.
You can demand better. I'm not saying you can go in and ask for a filet mignon versus the spaghetti that's on the menu tonight. Okay. That's a little unreasonable.
So here's one for you about that. So I get this one, right? I get this issue. And they're telling me that the skilled nursing facility, they're no longer reheating up room trays. And I'm like, so if you don't meet this right now, You're telling me there's nothing in your facility to reheat this tray? And I'm thinking, I said to myself, that doesn't sound right to me. That doesn't sound right at all.
What a wonderful world. $10,000 a month and you can't get a reheat?
Exactly. I'm like, are you kidding? I mean, it's just these little things that are just, I've seen them drop off room trays that sit there for an hour. Nobody even offers the patient to feed them. Nobody, and then they document refuse and the patient doesn't eat. And then here I come and I'm like, what did they eat today?
When they could have handled it. And see, I'm a family member. I'll walk in there. She didn't eat. Why? Did you try?
Right.
What method did you try? Did you try an out of the box method?
Right.
You know, is this a pattern? Is the doctor aware? Why wasn't I aware?
Right.
You have to get in there and champion that cause.
Right. Absolutely.
Doesn't matter. It could be 10 different causes for one person. You've got to have the wherewithal and the education and the determination to do it. And that's what my business does. It helps people learn these tactics so that they're powerful patients. And if they come in droves as powerful patients in the healthcare system will be forced to change.
Absolutely. Absolutely. And so this one is from Tabitha Ann Benton. This is the same line as above.
Hang on 1 second. Okay. I gotta get a water. Hang on. 1 second.
All right.
There. I'm so sorry.
You are all good. No worries. Like I said, this is a very relaxed hangout.
Okay. And my daughter finally is in the shower when I needed her to get me a bottle of water.
Isn't that funny? Yeah. So Tabitha says this is the same lines as above, the second part of her question we actually answered already, but this one, and I really want to focus on this one too, because she's a family caregiver. But abuse, when the caregiver is the one being abused mentally, emotionally, and verbally by the ones they care for, what are their rights, and do we have rights? I kind of feel like we don't. I'm sorry.
You know what? You know what it is? I've never seen spelled out caregiver rights.
Never.
They only just passed the RAISE Act for family caregivers, giving them some kind of solace. And we don't even know what they're doing with that. You know, in my group, which you're a part of, and so is Tabitha, the Caregiver and Patient Protection Project, we haven't heard a word.
Right.
What's being done for caregivers? They're dying, for God's sake, to take care of people.
Well, not only that, exactly.
And I've never seen anything about caregiver rights.
No.
But you do have the right as a person not to be abused.
Right.
You do have a right as a person not to take what's being given to you, even by people you love.
Right.
That is domestic violence, technically. And I know a lot of times dementia comes into play. And I know that, you know, just, it's horrible.
It's hard. It is hard on all spectrums. I think really at the end of the day, whether you're a medical professional or you're a family caregiver, we're all simply really trying to do the best that we can with what we've got, a broken system that doesn't serve us. And I don't care how many, I don't care how nice your facility is. I don't care what the hell you've got written on your credo.
Right.
Or your manifesto. I've walked into incredibly brand new, clean facilities and seen
state-of-the-art
shit care. I was precepting somebody and we walked in and I know this patient's actively transitioning. I know that we're getting there, right? 15 years of doing this work has led me to believe everything I'm seeing here, this person's passing. First thing I do, we need to get some pain medication. When was the last time they had any pain medication? And can you give that right now? Absolutely, before you even provide care, right? We don't need to let people receive care in pain. We just don't.
Right.
And her mouth was crusty dry. She had a ton of linens bungled up underneath her. And I'm saying this is a brand new spanking beautiful facility, beautiful room.
Well,
and
guess
the
what?
care is crap.
You can put a dress on a pig. It's still a pig.
Exactly. And so I said,
it's happening.
I said to her, I said, you know what? I'm actually glad that you saw this, because when I got done with her, her hair was clean. She wasn't in a hospital gown. She was in her own nightgown. You know, her nails were done. She was positioned with pillows under both sides. Her head was elevated. Her feet were elevated. She was comfortable. She'd had some morphine. Like I said, this is a prime example. I'm glad you saw this today, because you have the ability. This is the beauty about what we do. You have the privilege and the honor to make sure that when you leave somebody you care for, that they look like this, regardless of how you found them, right? That they look like that they are given the respect and the comfort and the dignity at the end of their lives. And I hate that we have to wait till the end of our lives to receive that kind of care. So, oh man, and girlfriend, we can go on about this all day.
I know.
All night.
You know what? Caregiving, I got to give it to caregivers. They are a group of selfless.
Oh, completely.
Amazing human beings in a thankless job.
Mm-hmm.
In a thankless job. I applaud each and every caregiver. And that's another part of the reason I started my business, because I saw my mom just take a horrible downturn. She had no idea what she was doing. She was thrown right into it. I mean, there's so much preparation that needs to happen. And I encourage that even when your parents are not ill. You have to prepare for war in a time of peace. But no one deserves to be abused. And, you know, there's just not enough respite out there. There's not enough money out there. People are leaving their jobs and no income to take care of their loved ones, and then they're getting beaten on. And
I know.
It's horrific. It's horrific. And they're just, honey, let's go to Washington. We need to talk for caregiver rights.
I'm totally down for that. I'm totally down for that.
Now, I know you're a distance away, but I'm only 3 hours.
I'm in Washington State, not DC. I'm in Washington State.
We need. That's why I started the Facebook group, because with that RAISE Act for family caregivers, they said the public's input would be allowed, and I want each and every one that's on my page and beyond to be heard, because if they are allowed to sit there and just build a caregiving program without talking to real, true, professional and private family caregivers, they're gonna screw it up.
Yeah.
They're gonna screw it up.
Mm-hmm.
You all are on the front line every single solitary day, day in, day out, sacrificing your own life. And it needs to be done right. We got to get to Washington.
Absolutely.
Something's got to give.
Somehow. Absolutely. And that's what I've been thinking, because I've oftentimes thought, when I go in, and I'm basically teaching family caregivers how to provide end of life care, how to care for a bed-bound transitioning patient. And I oftentimes think to myself, I wish there was a module that I could give you and say, here you go. This is the information that you need. And I would love to create that. How I'm going to create that, when I'm going to create that, I don't know, but I'm going to create that. I'm going to put 15 years of heart and soul doing this work into something that's going to benefit.
We're going to talk anyway, and I can help you with that.
But through the state of Washington, I can't provide education as a certified nurse's aide.
Are you joking?
No.
I do have a caregiving module, though.
Yeah.
I do have a caregiving module.
So, actually,
that relates to advocacy.
Okay, so actually, how do I say this? It's not within my scope of practice or my role as a certified nurse's aide to be to educate anybody. However, I have some things in place that is going to allow me to get out into the community, eventually to speak and teach about Alzheimer's and dementia.
Awesome.
But that's going to be a transition because my employer, regardless of whatever credentials I have, as long as I'm a certified nurse's aide, I cannot work for them and provide education in any capacity as a certified nurse's aide in the state of Washington.
Okay.
So that will be a hard transition, but that's ultimately my goal. That's what I want to do. I love providing end-of-life care. I'm telling you, it is the sole work of my life. But I want to speak up, and I want to teach people. I want to share my care philosophies with people. And if I can't provide hospice care with a medical institution and do that, then I guess that's what it means. But ultimately, but look at you, you're a prime example of what can happen for sure.
Yeah. And, it didn't just happen. God has a funny way of doing things, and I'm a woman of faith. I've got a big mouth and stuff, but I am a woman of faith. And God does things in a funny way. And I've been on disability for a while for my chronic pain and whatever rainbow of other things I have. And, I've just been doing this as I've gone along. And while I've been trying to teach, I've been learning, through my experience and through my experience with my grandmother. That was the catalyst for everything.
Yeah.
But as I've gone along, I've learned more and I've seen more and I've watched healthcare change. And I just want people to understand you have the power and it can be done. Healthcare can be better, but you have to demand it.
Absolutely. I agree.
And as far as, Tabitha, and I love her to pieces, she's in the group too. Tabitha, documentation.
Yeah.
Because if somebody ever does come to you and tries to act like you're at fault, you have documentation. And again, let providers know.
Right.
Because they need to help you address the problem. Right. As well.
Agree. 100%. Thank you so much, Tiffany, for coming out and talking about this. Like I said, it is my passion as well. We could talk about this all day, every day.
We're ending?
We are. I gotta go eat some dinner, girlfriend.
Me too. I really am hungry. That's why I'm like eating chips. But
so
I had a wonderful time.
Me too.
Call me anytime. I'm ready to talk. I'm ready to help. I'm ready to let people know what's happening. Awesome. And if you don't mind a little shameless plug.
Plug it in, girlfriend.
If people want assistance with their health care and their treatment, that is my primary goal in helping you. And you can go to LBB, Larry, boy, healthcareadvocacy.com. See what I do. You can get a free consultation. We'll talk, and, I'm trying to make a program for businesses. Let your employers know you need more than just healthcare. You need, caregiving. Right. And that's what I'm trying to be as well. Good. Like an advocate for caregivers, that work still in businesses. Because employers can take on a role of helping you and they need to. You spend 1/3 of your life there. Let them know that you want help.
Amen. Absolutely. Tabitha, there's your question. Here's your advocate. What do you do? Here's your advocate. Good to know. Good to know. All of you caregivers out there being abused by your employers.
That's right.
Tiffany is your girl. So awesome. As I said, we're going to have a list of all 50 states, the ombudsman, and the numbers to call them. There's a link. And shout out to Jenny Gibson, who gave me that link. Jenny is Genevieve Gibson. She is on the National Nursing Assistance. National Nursing Assistance association, I believe.
Mm-hmm.
So she's a great resource. She's given me that link and a few other links. So all of the links to the information, your patient bill of rights, your resident bill of rights, and definitions of elder abuse and what you can do about it will be in a file in the Caregivers Hub, along with the website that Tiffany just plugged into you, because that's a good resource. Again, make sure you're looking in the files of the Caregivers Hub. There's a lot of great information there. Anybody at any time can create a file within the Caregivers Hub. So if you have resources or any information that you feel would be beneficial to caregivers, professional or family, on their journey as a caregiver, plug it in, let me know, and I will make it happen. So all my blessings to all of you. We'll catch you next month when we do this again. Bye-bye.
Good night.